Okay. Okay, good evening, everyone, and welcome to our second seminar. I'd like to thank everyone for joining us this evening. It is an important event this evening, drug awareness, and we have some wonderful speakers that are joining us this evening. But before we introduce them, I'd like to say an extra special thank you to our Council of VP. Well, first of all, I'd like to introduce myself. My name is Allison Birch. I'm the Council President of Syosset PTAs. And I thank you all for joining us. I'd like to introduce Karen Ostrich, if she could give a wave. She's our VP of Health, Nutrition, and Safety. And I'd like to thank both of our chairs for the committee, April Sontick and Melissa Cappy, who have been helping us put together all of these wonderful programs for our Syosset community. And I'd like to extend a tremendous thank you to Josh Lafazan and for collaborating with us always so we can bring all of these terrific programs to our community and all of the children and parents. So thank you, Josh. If you'd like to introduce everyone this evening for our wonderful program.
Sure. Well, thank you for that introduction. And let me say, my name is Josh Lafazan. I'm proud to serve as Nassau County Legislator representing the 18th District. And it's been a pleasure to work with the Syosset Council of PTAs. For those who are joining and didn't join last time, I went to Syosset schools and the PTA made an important difference in my career as a student. It meant a lot that parents cared, not just about their own child, but about every child. So thank you to the PTA for all that you do on behalf of our children. This issue is important to me, this issue of substance abuse and drug addiction. I've lost 5 friends to the disease of substance abuse. Drug addiction is a disease that does not discriminate between age, sex, socioeconomic status, race, etc. We've made some marked improvements in Nassau County, on Long Island, and in the States in our fight against drug addiction, but this war is not over. Last year we lost more people to substance abuse than in the entire Vietnam War. In 1 year, over 70,000 people. When you add in alcohol abuse, we lost over 180,000 people. Information is key, and tonight is all about information, and it's why I'm proud to introduce our amazing panelists who are going to disseminate that information to all our parents. I'll start with my friend Claudia Frizel, who's an exceptional peer family recovery advocate. Her family has been directly impacted by substance abuse disorder. Claudia's strength knows no bounds, and she's been an amazing advocate to help parents and individuals suffering from substance abuse. So Claudia, thank you for joining us. Next, we have Kim Laube, Executive Director of Human Understanding Growth Services, or HUGS Inc. They do phenomenal work providing individuals, families, schools, and communities with prevention, education, and statistics aimed at reducing high-risk behaviors among our youth while fostering positive attitudes to improve all areas of life. Next, we have Steve Chatzman, who is the exceptional Executive Director of LICADD. Steve's bio is about 8 pages, so I'll shorten it to say that not only does he lead LICADD, but he serves as a clinician and health advocate for individuals and families with mental health and substance abuse disorders since completing his Master of Social Work at UPenn in 1995. He began his career as a healthcare advocate while receiving his undergrad degree in sociology from NYU in 1992. And he's been a remarkable and powerful voice in the fight against substance abuse. And lastly, I wanted to thank one of my mentors and good friends, Renee Feichter, who's an assistant district attorney here in Nassau County, who does so much, but primarily for tonight, he heads up the Nassau County Heroin Prevention Task Force and does amazing work year after year to keep our community safe. So you have a treat with our panel tonight. With that, I'll turn it over to Allison.
Okay. I think is Steve, you're going to start this evening to talk?
Absolutely. And
okay, thank you so much.
Thank you to the PTA and to all the parents, students, or whoever else in the Syosset area is tuning in tonight, to Legislator Lafazan and Mr. Renee Fleischer with the District Attorney's Office in Nassau County. It's an honor and privilege to serve on this panel, particularly with Kim Laube and Claudia Frizel, who I consider colleagues and good friends in the fight. So stating the obvious, I greet you 9 months into an international viral pandemic where social isolation, insecurity, fear of the future, grief and loss, social distancing, and like I said, living in the uncertainty, unfortunately, is where we are. So just so you know, the Long Island Council on Alcoholism and Drug Dependence is in its 64th year of human service. And despite, as Legislator Lafazan said, the last 10 years of a bona fide substance use pandemic, the last 9 months have been challenging for us all. So I say that without judgment or just merely accepting where we are. Certainly all eyes are on Long Island students or American students, obviously school-based faculty, and all the essential workers, which includes mental health professionals that are doing our very best to make sure that as a community, a Long Island community, and Kim does amazing work on the East End and beyond, we're bi-county. Claudia goes all over, including to Washington, D.C., but putting a safety net together so that none of us fall through the cracks, not just for a physical viral infection. And remember that New York was hit hardest and first and has some of the highest mortality rates. So it's my prayer as we embark on a Thanksgiving holiday that your loved ones are safe. But the truth is, we all know one or more that have been impacted by COVID, particularly our aging population. So second to that, but equally important, is the mental health fallout. So you don't see him on camera, right? But our Director of Programming, Adam Birkenstock, is assisting me tonight with some of the technology, but heads up an incredible team of clinicians that are on call 24 hours a day in Nassau and Suffolk and beyond the 5 boroughs. And that's why we know that people are living in a heightened state of fear, stress, anxiety, isolation. And this has always been, and regrettably probably always will be, the breeding grounds for substance use, misuse, abuse, and for some, dependence. I won't bore you with statistics, but Legislator Lafazan and the PTA touched on it. By the way, LICADD, among others, has a great relationship with the Syosset School District. So it's important to know that in 2019, in America, there were 72,000 opioid fatalities. Now, people don't wake up one day and say, today I'm going to use an opioid. It happens with a substance use progression, of which we're going to get into tonight. But you should know that last year, which we don't talk enough about, 72,000 fatalities around opioids. Same year, 2019, 88,000 fatalities related to alcohol. If you remember in March when the world shut down, yes, here in New York State and Long Island, schools and businesses, no judgment. But somewhere along the line, liquor stores were deemed essential businesses. So as moms and dads and guardians and single parents were home and homeschooling their children, as the old song goes, it's 5 o'clock somewhere, may have become 4, 3, and noon for some folks, in an attempt, and we don't judge, obviously working at LICADD, there's no judgment around substance users. Just know that it is the human condition in times of great fear, anxiety, stress, to seek comforts. It's just the human condition. The reason many of us are anxious right now is because we are living in times of great uncertainty. And you know, most human beings are creatures of habit. We like to know that this is our day and this is our schedule, even a school schedule for parents who have school students in the Syosset. First period, homeroom through 8th period, lunchtime, study time, weekends, right? And all of that with the onset of COVID-19 obliterated any sense of security or routine that we've had. And then it put us into those high risk areas for self-medications or self-soothing. Now, make no mistake about it, I'm going to say this, forget about the credentials. This is as simple as I can explain it, and this is how it was explained to me. When you take mind and mood altering drugs, and we'll get into what some of those are, your mind and your mood get impacted. So I'll say it again, and we can almost call it a night after that. When you take mind and mood altering drugs, your mind and your mood get impacted. Now remember, all substances have something in common. A definition of a drug, by the way, anything we introduce into our bodies that produce change in normal body function. And that includes antibiotics and all that, increasing white blood cell count, whatever. When we ingest alcohol, when we ingest THC, caffeine, amphetamines, opioids, stimulants, we are looking to medicate certain things that in our lives that cause discomfort. Now, if Dr. Stephen Dewey, and I know you have a relationship with your school and Dr. Dewey, I mean, this is a neuroscientist who will tell you that these dopamine surges or pleasure chemicals, they mask fear. How do we know they mask fear? Well, have you driven along Long Island highways recently? I'm coming to you live from Westbury, New York. I happen to live just east of Huntington. So I drive the Northern State every day. We're right off the Wantaw Parkway here, our executive office. We have offices, so I'm on the road a lot, and LICADD's offices have been open. Have you noticed how many flowers are around trees lately on the Wantaw Parkway, the Northern State, the LIE, the Southern State, or some of the county roads? Now, I don't know this, but they seem to be relatively fresh pictures of young men and women who have made perhaps some unhealthy choices themselves or been the victim of the unhealthy choices of others, where more times than not, and we have great relationships with both police forces and district attorneys, that alcohol and or other drugs play a role in unhealthy choices. If I can ask Adam just to go back to the last slide. You know, stage left right there, if you could read that fine print, talks about abstinence. Most people experiment with drugs at 12, 13, 14. It was true when I was a public school student in Belmore, Long Island. Someone probably with shorter hair in the 1970s or 80s said there's 3 gateway drugs. Alcohol, the most lethal drug in America still. Marijuana, or THC, the active ingredient in marijuana oils and vaping products now, not to mention edibles, and we'll talk about that. And of course, nicotine. These are the gateway drugs, but those 3 are not innocuous as defined by Webster as harmless. Again, alcohol, the most lethal drug in America, all right? Deemed essential businesses. Everyone talks about heroin or opiates. Listen, you get addicted to heroin, you'll go through withdrawal. Heroin withdrawal, you'll wish you were dead, but it won't kill you. Alcohol withdrawal will, without a medically supervised detox, physical, psychological, social, and spiritual dependence. So that's alcohol. Marijuana, if you're a parent, and you know, Josh was reading my CV there, so if you're doing math, I'm over 50. So if you think you knew marijuana in the 80s and 90s, this ain't it. You know, if you're a parent that says the legalization of marijuana, listen, maybe my 20-year-old self would be like, woo! But knowing what I know, 30 years in the field of human service and being an addiction specialist, this marijuana and the THC levels, the edibles and the oils and the wax and the dabs, the THC levels are significantly higher. New Jersey just legalized marijuana. There are several other states that are on the road. We've had medical marijuana and decriminalization for many years. But let me tell you, at the height of a national pandemic, when young people and adults, quite frankly, are in a heightened state of fear and anxiety, to legalize a drug that has serious psychosocial implications right now is almost leading human beings to the trough of self-medication. Now, this is not a judgment of our governor or any other governor or legislature that passes for the legalization of marijuana. I don't think people who self-medicate belong in jail. If you're thinking, what is he talking about? Sometimes drugs, including alcohol, can be used for recreation. Yes, it could. But since we know more about addiction or substance use disorder than ever before, we know there are genetic predispositions that sometimes this obsession and compulsion runs in family trees. Obsessions are recycled thoughts. I need another. I need another. They lead to compulsions, which are repeated behaviors. I take another, I take another, I take another. And it almost always begins in elementary school, junior, or high school. Adolescence is a really precarious time in human development. And it's a challenging time. Now, adolescents right now are being deprived of social interaction. They are navigating a host of different change. In some cases, maybe better than us when it comes to the digital and technological movement that's happening right before our eyes. All right. So it's really important that we teach them healthy coping strategies. Because if not, if they introduce alcohol at a young age, and remember, age of first use, 12, 13, 14, alcohol, THC products, and now nicotine, not just through cigarettes, because we did really well with adolescent smoking, right? But with the vaporization of nicotine, which is a stimulant. By the way, what are the other stimulants? Methamphetamine, amphetamine, cocaine, and of course, the unofficial drug of social work, caffeine, right? Listen, I think it was a major tragedy when Starbucks shut down for March and April and May. I know several people that were distraught and they were dealing with headaches. And I'm not making a joke about that. They just couldn't get their dosage of caffeine because Starbucks, I don't know what they're doing to those beans, but don't get me started. And I'm a fan as well. So it's really important to understand that in the last 10 years, because of a very changing world, culminating with a pandemic that has taken 9 months and taken a toll on us all right? It's really interesting to understand that when you introduce self-soothing mind and mood altering chemicals at a very, very young age, you are setting the foundation of what could become an unhealthy trajectory that every time that people experience unhealthy or, less than pleasant emotions, we always talk about coping strategies. What are we talking about when we say coping skills? What are we trying to cope with? The answer is the emotional spectrum. So we always use this little nursery rhyme. Here's where my Long Island accent really comes out. But mad, glad, scared, and sad. Mad, which is anger, right? Sadness, melancholy, a depressed mood. Scared, which usually is fear, which stands for forget everything and run. And then there's glad over here, which is happiness or contentment. At an early age, if you assign a pill or a powder or a potion or an alcoholic beverage to either stimulate or to soothe any one of those 4 primary emotions, of which there are thousands of emotional states, we potentially are setting the stage for every time they want to experience an emotion, it is required. Everyone knows next Thursday is Thanksgiving. I think it'll be a little different. We hope, according to CDC and the Department of Health, it may be a different Thanksgiving. So everyone knows what the night before Thanksgiving is. It is one of the biggest binge drinking nights of the year. Why is that? And why is it primarily young people that come home from college? Well, let's face it. I think we touched on this already, but let me say it again. And I don't mean this as a judgment because I'm a human being too. Human beings, we're all a bunch of scaredy cats. We're always self-conscious about ourselves. We're constantly worrying about the future and our past. This is all of us. It doesn't mean it's a bad thing. Not all of us are struggling with general anxiety disorder or depression. We're anxious by evolution. We're constantly thinking of, are we going to be okay? Remember, we're constantly looking for that security. And right now, most, if not all of us, are out of our comfort zones. All right. So it is no surprise that we are seeing an increase of self-medication with a whole host of substance use. All right. And as people come home, it is really important that, and listen, I'm not here to tell parents how to parent, but it is really important that during this critical age from 13 to 21, right, or 25, which is really how we gauge adolescence, it's really important that we model healthy behavior. Now, you notice I said healthy and unhealthy. I'm in the field 30 years, and listen, I've never said in a public forum, I've never said to an individual or to a family drugs are bad. I'm not here to call things good or bad. All right. It comes down to healthy or unhealthy. It's what people do or don't do. The truth is, and I'm going to say the word is karma, right? And I don't mean the spiritual implication. Karma is the laws of nature. When you engage in healthy behaviors, you get healthy outcomes. When you engage in unhealthy behaviors, you get unhealthy outcomes. It's not my rule. It's not LICADD's rule. If I was hungry, every time I'm hungry, I roll through McDonald's and get the number 2 and the supersized McFlurry, Oreos, mind you. Over time, I may not appreciate my waistline, the salt content, I may not feel good. I wasn't sure I was hungry. It turns out that was an unhealthy option and I got unhealthy outcomes. So it's really important now that we talk about healthy coping strategies. So parents, please, It's not for me to tell you where to keep your alcoholic beverages. You're older than 21. It's not for me, and I'm not suggesting any Syosset parent does, but it is not uncommon for adults to be engaging in recreational marijuana use or other substance use. I don't condone it. We meet the issue where it's at. But it's really important that we model healthy behavior in front of our young people, particularly now. Now, I'm not directing this at any of you, but if we're trapped at home, for lack of a better word, if we're socially distancing and isolating at home because of a shutdown or because our work has been suspended or we're working from home, do they see us running to the kitchen for a glass of Chardonnay from the fridge or the glass of red wine or the vodka that's in the freezer next to the Haagen-Dazs? Or maybe it's the Haagen-Dazs itself. Ladies and gentlemen, I regret to inform Haagen-Dazs is not a healthy coping skill either. Sorry. When we talk about healthy coping strategies, we are trying to navigate the emotional spectrum, the mad, glad, scared, and sad. I think there's a heightened scared right now, but there are healthy coping strategies that bring it about. Understand that people can use substances with impunity, some people. But when young people introduce marijuana, alcohol, nicotine, prescription medication, when an adolescent brain, the prefrontal cortex, is not fully developed until 25, it can hijack neurological wellness, it can hijack emotional wellness, and it can hijack biopsychosocial and spiritual development. All right. Now, if you're a parent, I don't judge people who fell down that slippery slope, but ultimately, and Kim could attest to this, as Claudia could, and other professionals in the field, I won't bore you, but I'll tell you that in the field that I work in, and Kim works in, and Claudia works in, there's, for lack of a better phrase, a Bible of mental health called the Diagnostic Statistical Manual of Mental Disorders. It's put out by the American Psychiatric Association. General anxiety's in there, depression's in there, psychotic disorders are in there. And you know what else is in there, right between all those? A whole chapter on substance use disorders. Now, why do I say that? That at some point, for some people who get into experimental use, and then they start self-medicating certain emotions and it becomes abuse. And even some, for dependence, that is a lifetime of engaging psychosocial supports, relearning healthy coping strategies. The thing about young people is they're very malleable. We still have an opportunity to teach them healthy coping strategies. And it's so important that in this critical time, in this time of our nation, this time of crisis, that we're not only teaching, but modeling healthy behaviors. So just looking when we talk about vaping, again, the way adolescents are using vape products, not just THC, which the THC levels in oils and today's genetically modified marijuana is significantly higher than Mother Nature ever intended it to be. It's really important that we try to explain to them that this is very potent psychoactive chemicals. Again, this is just my opinion, but as a professional who works in the field of addiction, let me say this. This is probably the most horrific time to approach the legalization of marijuana. The reason being is we are primed for self-medication because of the general anxiety that has enveloped the country. And in fact, right here on our fair island. We have seen the flooding of our markets with the vaporization of nicotine and these vape shops that have popped up. And not only have young people flocked to these, but they have misused, abused, and in many cases become dependent. Dr. Howard Zucker, who has his hands full as the New York State Commissioner of Health, we did host him in Roslyn just before the pandemic hit, when we were pushing LICADD for the ban of flavored vaporization products. Because I got to tell you this, and I've been in dispensaries in other states that have legalized marijuana. And I have to tell you, this is not geared. These shops, this is a multi-billion-dollar industry, not geared towards 51-year-old men who want to sit back and smoke a little weed, watch reruns of Seinfeld, and eat that Haagen-Dazs. If you go into these dispensaries in other states that have legalized marijuana, All right, and we're getting data out of that is not good, like the Colorados and the Arizonas and Californias, etc. This is geared towards young people. It's loud music, it's edibles, it's gummies, it's really kind of interesting packaging and so forth. This is not geared towards adults. So that's my fair warning on that. We just go to the next slide. This is a letter from Dr. Howard Zucker talking about the warnings around popcorn lung and some of the pulmonary diseases that we've been seeing as a result of the vaping epidemic, and it is epidemic proportions. It's really important to know that. By the way, vaping, nicotine, and/or other products has not been studied in the long term. So we've seen in the COVID crisis that people who abuse vapes actually put themselves at a greater risk for COVID and pulmonary illness. So that's something to be very conscious of. So next slide, moving right along. Whole host of reasons why individuals use substances. Self-medication, it comes down to. What are we medicating? We are medicating that emotional spectrum in a really, really challenging time. You could go down this list right here. It's okay. Particularly adolescents. Remember, you're going to be invited to a party. Hopefully it won't be more than 10 as per the governor's mandate. But what's the first thing at Thanksgiving or a holiday party that anyone would traditionally offer you when you walk in their house? They would offer you an alcoholic beverage. Why is that? Why is it socially acceptable to give alcohol to their adult and or adolescent guests? And I've seen adults give it to adolescents or adolescents to adolescents. The reason being is any good host or hostess actually wants their guests relaxed. And you know what alcohol does? It does what any drug does. It masks fear. And if you could see a holiday party at 7 p.m., people are a little more civil than they are at 10 or 11 p.m. once alcohol and or other drugs have taken over, because alcohol and other drugs mask fear. But you know what? You know how we manage or cope with our fears? We address them. So when we talk about healthy coping strategies, and there's the next slide, if you will, there are healthy ways to cope with stress and anxiety and fear and insecurity. And we talked about some of the mind and mood altering drugs. We can also talk about unhealthy eating or binge eating. I think some of us over the last few months have been overindulging in self-medication with food. Tonight's not self-disclosure night, but listen, the word McFlurry is not unfamiliar to me. And I mentioned the Oreos, not M&Ms, personal choice. But in the end, that is not making me happy when we have to engage in unhealthy. The way to address our fears is to actually call them by their rightful name. I don't know what the future will bring. I don't know what is going to happen to us, but let me share that with my supports. Let me utilize some of my support network, beginning and ending with my parents or my parent or my guardian or my faculty at school or clinicians at LICADD that you can reach remotely 24 hours a day. People do it with gambling. These devices, and if you've seen some of the documentaries on Netflix around devices here, this is a whole new world order right now. Now, yes, it's what we have to communicate, but listen, digital and what can happen on our digital devices in the way of gambling, unhealthy sexual practices, there are a whole host of ways to unhealthily cope with the emotional spectrum. And of course, the healthy ones. Just about out of time, but I have to talk about the healthy ones. If technology failed right now, please know the greatest reducer of stress, the greatest outlet we have is exercise. Now, I know organized sports in many districts across Long Island have been modified or in some districts flat out suspended. I know the weather is turning colder. It is so important for young people and adults to stay motivated, to utilize exercise or the great outdoors, the good orderly direction. We're blessed to be surrounded by water on all sides. Beaches are open all year round with the proper attire. It's so important. Because of these devices, this may be the most sedentary generation we've had. Young people are afraid to go outside because of not only viral infection. I had a young person say to me last summer, the summer before this one, he says, "Oh, I don't go outside, West Nile virus." Now he was brought to LICADD because he's huddling in his parents' basement, paying 20 hours of PlayStation and doing a whole host of unhealthy things online as well. So we were challenged with these devices. But you know what? I have to tell you, there is a solution out there. Exercise, mindfulness. If we had more time, and LICADD is doing an Om for the Holidays training to teach mindfulness. Mindfulness is a momentary awareness of as things are, non-judgmentally. We don't, listen, I know a lot of intelligent men and women, Kim Laube and Claudia Fizell included, not to mention Legislator Lafazan, but none of us know how to tell the future. The only moment that we could really cultivate, that if we could save our judgments and that we're absolutely given, is this very moment. And you know what? Some of us are so far into, when is COVID going to end? When is school going to resume? College. You have 8th graders worrying about college. And a lot of us adults, we project to the future. When are we going to be able to go on vacation? When am I going to get my kids? I understand your concerns, but there's less anxiety if we stay in the day. Mark Twain had a great quote. He said, I can't believe I'm sane after all I've been through. And some of those things actually happened. Translation of that quote, let's not project to the doom and gloom of the future. I know we're all tempted to do it. Honestly, the last 9 months have been difficult. But please practice those healthy coping strategies. We have to be able to communicate with one another. Parents with their adolescents, with their children, children with their parents. And if you're struggling, to communicate with professionals, school-based professionals, mental health professionals. You should know, and ask Adam, him and our team are on call 24 hours a day. You could reach us if you need to talk. And by the way, during COVID, because of generous supporters, you can have a Zoom session with a licensed clinical social worker. This isn't self-promotion. We're waiving fees right now if you don't have it, because we understand people need the support. Resiliency, if we just touch on that word, and then I believe I'm out of time. Resiliency is our ability. It's a natural gift that human beings have to endure, to process, and to work through in times of crisis. By the way, if you're an adult, and somehow they let me qualify, if you're an adult, you know the greatest strength in your life, if you look back, the building of the most resilient character that actually makes you who you are today, were not times when we were on vacation or lying on the beach. You know, our greatest triumphs are those times where we think we will not get through, and then we do. Those times where things really aren't going our way, and we find new coping or resiliency strategies to get us through. Make no mistake about it. LICADD, and for those who know me, I'm not a doom and gloom guy. This is a challenging time, but we will get through it. But we need to teach each other how to get through it. Drugs and alcohol, I don't want to close on a damper note, but the last 9 months, the last 6 months, and most recently the last 3 months, we're losing the mental health battle. People who were teetering on the health and wellness mentally they're over that imaginary line, and they're calling for help in droves. It's okay. That's a strength. That's a resiliency strategy, to be able to ask for help. By the way, this is a fallacy. If you were raised saying any adult man or woman pulls him or herself up by their own bootstrap, it's a fallacy. We are human beings. We live amongst each other. We work amongst each other. We're families. We're schools. We're school districts. We're communities. This whole thing of intentional community is a bunch of malarkey. You gotta need each other. And we still do here. We will get through this. All right. But please let people know that self-medication is not the healthy option. LICADD is always here for you 24 hours a day. We have a great relationship with the Syosset School District. And I thank you very much for allowing me to present tonight. And with that, I have the distinct honor of introducing a friend and a colleague, and she has a great message, and I'm going to be sitting here listening attentively because I always learn something. The Executive Director of HUGS, please welcome Kim Laube.
Well, hello, and thank you so much, Steve. Thanks for setting this up tonight and adding your expertise. And I'm going to echo some and really bring home some of the conversation you started. I think it might be fun for the folks at home to try and figure out my word count per minute versus your word count per minute, because we know we both tend to talk really passionately and very fast because there's so much to say about this. Syosset Schools, the PTA, thank you so much for providing this opportunity when so many schools right now just kind of have pushed this off to the side as they're trying to just handle remote learning or hybrid settings. And so congrats to you for making sure that this was part of the conversation. My name is Kim Laube, and I love, love, love what I do. And that works for me because I do a lot of it. In just 2 seconds, I'm going to share with you my screen, and that should be coming up any minute now. I hail from the end of Long Island. I'm actually, I live in West Hampton Beach. I was born not here, but I have spent my time raising my family here and raising myself here pretty much. So I have some time to talk with you today about what it's like being a parent in a world where addiction is just so big and it's vast. And we know that that creates tremendous challenge when it's all around us. I didn't grow up saying I want to do drug and alcohol prevention when I get older. I start here and I'm in this field because my job application sounded something like this. Yes, Your Honor. No, Your Honor. I'm sorry, Your Honor. And I'm never going to let that happen, Your Honor. And so my story starts from a place of PIN's petition. My mom, who had struggled with mental illness all her life and really struggled to find her voice, somehow when I was 15 years old, summed up the strength. And I always say that because what it must have been like for a mom to put me in front of a judge and place a PIN's petition on me. PIN's petition meant I was a person in need of supervision. I often say I'm still a person in need of supervision. I'm just a whole lot more polished today. But here I was, 15 years old, standing in front of the judge, and the judge sentenced me to community service. It wasn't the kind of community service that looked good on a college application. It was the kind of community service that if I didn't do it, I would wind up going to juvie. And as big, bad, and tough as I thought I was growing up on the east end of Long Island, juvenile hall scared the daylights out of me. And so off I went to do community service. And I share this from a place of the importance of the PTA. And I love the opportunity to talk about the PTA, and Josh touched on this in the beginning as well, being really there for students. But as I was doing community service, I was working in the office of our high school because they let me do it there. And I probably had jeans that had holes in them, not because I thought I was setting some trend fashion statement, but because we were on welfare and the hand-me-downs of the hand-me-downs were pants that had holes in it. I was rocking a Metallica t-shirt. I had a chain that went to my wallet that had no money in it, but I wanted you to be much more afraid of me before you realized how painfully afraid of you I was. And so this lovely PTA woman comes in. Her name was Mrs. Block. She had a Southern accent, and she has 100 posters for this program called Hugs. And she asked me to go around the school and to start to hang them up. Now, generally, I wasn't always so nice and willing to help out an adult, but for some reason, I liked Mrs. Block. She never had done anything to me, well, which pretty much meant she never got me in trouble for anything. And so I went around the school and I started to hang up these posters one by one. And I actually started to read what it said. It talked about going away for the weekend. And I liked that idea because I knew the stuff that went down when I was home. It talked about learning to be a leader. I had no idea what being a leader meant. I knew leadership was for the other kids. It was for the good kids. It was for the shiny kids. It was for the kids that the teachers always picked on. I was that kid that your parent told you not to hang out with. Now, the truth was I had leadership potential. I was just moving leadership in a very negative way. And so I liked kind of the idea that it talked about leaders. And then it talked about getting together with kids from different schools and talking about things that were important in life. There was something that intrigued me about that conversation because we were all just talking about things. We were just kind of planning the next party. Nobody was talking about things that were important in life. And everything inside of me wanted to go on this weekend. And by the time I hung up the last poster and I had gotten back in front of Mrs. Block did that awful thing adults do. She looked me dead in the eye and she said, "You know what, Kim, you should go on that weekend." And I thought once an adult thought I went on this leadership weekend that talked about drugs and alcohol, I thought it had to be the lamest program ever. And she looked me dead in the eye and she said, you know what, Kim, you're going to make a difference. I had to look over my shoulder to see who she was talking about because no adult had ever told me I was going to make a difference. She said, you know what, Kim, you should go. I said, I don't have the money. She said, I will pay. I said, I don't have a way to get to Shelter Island, which interestingly enough, so many people on Long Island have never been to Shelter Island. She goes, I'll drive you. I said, Mrs. Block, my mom's never going to let me go. She said, I will call her. And every time I said no, this PTA president, who really didn't know me, she just knew me as a community kid, saw me bigger than I could possibly see myself. And she drove me out to that campsite. And it was all the shiny kids, all the happy kids, all the kids that the teachers picked. And my skin was crawling. I wanted out. But by the end of the weekend, the end of that 3 days, I found community, I found home, and most importantly, I found hope. And I often wonder what my life would look like had a PTA president, a parent in the neighborhood, not come to me and say, hey, Kim, you should do this. And I am one of those people who never knows when to leave a party. And so I'm now the executive director of that same program many, many years later. And what sometimes we miss when we're teaching kids, you grow up, you go to school, you go to college, you get a job, and what success looks like, it's not a straight line. It's oftentimes has many different paths and many different ways. And it's kind of this labyrinth, right? And one thing can lead to another, which can lead to another. If you're a Westworld fan, I hope you are, that you'll understand that labyrinth. Or for those of you who are not, it's the shooting ladders labyrinth. But whatever it is, the path that we take, oftentimes we don't expect for it to go certain ways. And sometimes it does go in a dark place, and sometimes it finds a light place. And what we're here to talk about tonight is the impact of addiction. And addiction is a disease. And I know oftentimes we don't want to look at it that way. We see it as a moral failing. We see it as something the individual is doing to themselves. But we'll hope by the end of tonight that you begin to really hear what my friend Steve started to talk about and what I'm going to talk about. And that is, it's a disease of the brain. And that young developing brain is so crucial in this conversation. See, when we take a look at addiction, we have to look at it through a public health lens. You have the host, you have the individual, you have the person, which is me, you have the outside agent, which in this conversation, we're going to talk about it as substances, and you have the environment, in which case the putting of the agent into the host is able to just grow. It's the same as if I'm run down and I'm not feeling good and I maybe get exposed to a cold, and I know we're in the middle of COVID, right? So that's kind of a very big conversation. But the environment, if I'm around it a lot, it gets to grow and take off. And addiction is no different than that. See, when we talk about any disease, we have to talk about building up protection, building up resistance, building up ways to help keep your body strong. And so we talk about it in many ways for physical health, but let's take a look at what it looks like to a young developing child. See, that's a picture of me. I know I look a lot heavier in that picture. The jokes don't change whether I'm live or on Zoom. So if you've heard me before, you know that's a line I always say. But there are 4 different ways that protect me and protect you and protect your students: family, school, friends, and community. And if everything goes perfect on all 4 of those sides, I have a wall of protection around me. If in my family is connected and we do things together and there's rewards for us being active with one another, and I feel like when I get home, oh, that's my safe place. That's my home base. When I feel that I get there and attached to my family, there's a solid blue line. And if in my peer group, we're getting involved in positive things in our school, and we have an understanding of social skills and a belief in a moral order, and we have an understanding of being of contribution to one another and helping out, that is a solid blue line. And if in school, I start to feel like I'm part of and I belong, and there are things for me to do in my school, whether I'm an athlete or whether I'm an academic or whether I'm a theater kid, no matter what, that I have my place in my school, people recognize me, they identify me, and they reward me for my involvement in the school. That's a solid line. If in my community, there are opportunities for me to do positive, healthy things in my community, and I feel like I belong in my community, that I can, in fact, begin seeing myself creating my family here and living my life here, that's a community protective factor. If all of those things go great, my life is going to be knocked out of the park, and I'm going to have a really solid foundation to move forward on. But when risks come into play, and risks don't have to happen on all sides. As a matter of fact, you can do everything right as a family. You can do everything right in your school district, but drugs and alcohol are still in the community. And so I want you to be really clear that sometimes there's breaks in that solid blue line, but it doesn't have to happen on all four sides for addiction to be able to step in. And so I want to talk about the family. Maybe in my family, there's a family history of drug and alcohol use and addiction. Maybe we're having a tough time managing my family. Maybe my family's working 2, 3, 4 jobs just to try and stay on Long Island, which whether you're in Nassau and Suffolk County, we know that that's a reality, especially now. Maybe my parents feel that it's safer to let me drink in the basement with my friends and learn how to drink at home before I go off into college. And so by giving parental permission, it actually begins to set parental attitudes that are favorable for it. And so maybe in my family, we believe that we'll just teach you to drink and let you drink in the house because it's so much safer than you being out there and doing it. Maybe in my community, there's a ton of drugs and alcohol available. And ladies and gentlemen, we know in our communities, there's a ton of drugs and alcohol available. If you have a community coalition, one of the things we love doing is having people take account of how many establishments sell alcohol in your defined community. I will share with you, I live in West Hampton Beach. That's a 2.9 square mile radius, 2.9 square miles. We have 3 liquor stores and 47 liquor licenses. When you begin to take a look at how much alcohol saturation, it's totally become the norm. And now gas stations and 7-Elevens and convenience stores are full stocked and ready with a sale. Maybe my peer group begins to explore with drugs or alcohol earlier, and maybe that people see that's a good thing and people are being rewarded for that. And maybe I begin to struggle with some stuff. It's not just drugs and alcohol that we have to worry about when any of these sides get broken down. We have to take a look at unprotected sex, unhealthy relationship, high-risk behaviors, teen pregnancy, alcohol, drugs, and of course, a negative outcome. And the truth is, every kid and every adult, if I was to be so bold, looks for a sense of belonging, a place where they feel at home and in their heart, and at home and in their space. They look for meaningful ways to communicate. And we touched on this, Steve touched on this about technology. We've given everybody so many different ways to communicate, and yet so many of us feel so incredibly disconnected. And we all are looking for a sense of community, whether that is our athletic teams or our theater community or just our group of friends, but that place where we're lifted up and we feel that we're part of, and worry and fear tend to move away. And I can't talk about community without talking about one of the biggest mistakes our group of parents made. And it gets reflected in this. This is where I came from. Born in Brooklyn, they moved me out to the east end of Long Island early on. But I can tell you that that's my girl right there. That's my grandma. And I love sharing about her, one, because I just miss her tremendously. We lost her about 4 years ago. But I love sharing about her because it was her job to hang out of the window at Brooklyn and yell at you long before you ever got home. She probably had a house coat on, a wooden spoon in one hand. Whether her teeth were in her mouth, it was a 50-50 on that. But she was yelling at you all the way. We stopped looking after the neighborhood kid. We stopped saying, hey, you guys, knock it off, go over there. And vice versa, we stopped allowing other people to parent our kid. And as a matter of fact, we would get all upset about it. Don't tell my kid what to do. And the truth is, we can't be with our kids all the time. The truth is, there's this whole world that is responding to them. And so adults stepping in and looking after the community children is something we so desperately need now more than ever. And oftentimes as parents, we're like, well, they're not going to listen to me. And the truth is, you still remain the number one influence on your young person's life, the number one. It's your voice that they hear. And they came into this world as these little balls of perfection with no manual. And we had no idea how to figure out how to do this. And in my own parenting, I was just so amazed. And my only hope was that I didn't mess this up. And my frame of reference, and I guess most of your frame of reference, when we looked at families and what families looked like, the examples we saw were the Cleavers, the Partridge Family, Family Ties, Growing Pains, Cosby when we actually liked them, Full House, Urkel, and of course, the Brady Bunch. And life was solved in 30-minute episodes, and people were happy and clapped at the end. Could you imagine in your parenting moment, if you come home from a hard day at work or come out of the living room from a hard day of work, whatever your work world looks like now, and suddenly like everybody stood around and was like, great job. That's what actors and actors had for a very long time. And so the truth is life doesn't get solved in 30-minute episodes. As a matter of fact, here's modern day today, right? Just to bring it a little bit to today's family that we get to see in all of their dysfunction. And so I share that with you because for parents our age, this was the alphabet we got to learn. A was for apple, B was for bat, C was for cat. And it was a very simplistic kind of alphabet. And we kind of understood those laws and principles. And then here's today's alphabet. It's a whole different world. Their brains are wired differently. Their access to information happens instantaneously. They don't have to worry about pulling out that Dewey Decimal card and going down and figuring out what section of the library something's in. They just Google it, they click on it. And they have this way that their brains are wired where they can be listening to music, working on their homework, and still answer a question that you're asking from the kitchen. See, they really can multitask in a whole different way, well beyond what you and I could. Now, the truth is, as cool as this image is still outdated, but we've changed the way we're wiring brains today. And as we begin to think about how we move forward in our parenting to today's teen, which is so different than ours, many few of us have thought about creating health policies, raising our kids up with policies to not use, right? We get really clear on drugs. Drugs are bad, but oftentimes we don't include alcohol into that conversation. And what I hope is by the end of tonight, you really understand that if you really want to get ahead of this thing and increase your chances the best you can, we have to talk about alcohol as a primary. And if we want to really talk about how these things have changed, because so many people are like, Kim, it was like us. We were kids. We did it. We just turned out fine. And I can tell you how many of us didn't turn out fine. I can share with you that just because we rode in the back of a station wagon didn't mean that was a safe, smart thing for us to do. We had paper licenses that we changed the name. Today, it's $1 billion industry on how to get a fake ID. We smoked everywhere. Today, people don't smoke anywhere because they're afraid of being shamed about it. I might have taken an Air Supply album, sliced it in half, went up like this at the sun so I could get the best color. Today, we don't let our kids out in the sun unless they're like lathered in water babies, right? So just because we practice it and we survived, and again, I will argue with you, some of us didn't, it doesn't necessarily mean from a health knowledge standpoint that is good practice today. We know that not every kid that goes to a party and picks up alcohol is going to turn into having the disease of addiction, and not every kid that smokes pot. But we know for 1 in 9 or 1 or 10, depending on what research you're looking at, we know that that's exactly what happens. So 1 in 10 is the number we use suffer from addiction. But here's the thing that I really want us to think about and put into our parenting strategies. 90% of those who were diagnosed began in their teen years. And that goes right to that brain development that Steve opened the door for us to talk about. The brain grows from the back to the front during adolescence, and it grows at the fastest rate it's ever going to grow. And it doesn't hardwire immediately at the age of 25, right? It's an average age of 25. So this brain grows, shrinks until it catches up here. And all during that time, when we begin to put substances in, we actually change the wiring. We change what's happening in those young developing brains. And so we have to look at this as a disease of the brain and keep all of those substances out. This is probably the saddest thing that I can tell you is that 90% do not need help, do not receive help. That means 90% of us die, wind up in jail, have really, really awful existences. And that to me really begs us to talk about what can we do better? What about those 90%? We know it's a disease of denial. We know that shame riddles so much of it, and the stigma around it is huge. 90% do not receive help, and that is one of the saddest things I ever read in any presentation. We know that many of our families are impacted by it, and so if we sat and we talked for a long time, we would find out that my family was really not much different than yours. I want to talk about this 8th grade to 10th grade jump that we have on Long Island, and we actually have it across the nation. In 8th grade on Long Island, Nassau, Suffolk County, our kids actually they fall underneath the national norm for using a substance for the first time, which is great news for our 8th graders, right? It's about a 22%. Now, if you really start to think about that, 22%, that's 1 in 5, like all of a sudden we're like, oh, wait a second, it's not such great that we're underneath the national average. But I want to talk on what happens by 10th grade. By 10th grade, first rate of use jumps to 66%. That means it tripled in the 9th grade year. And so much is going on for our 9th graders, right? They're trying to figure out what group they belong in. They try and figure out what things that they have in common with others. But one of the big things that happens in 9th grade is parents stop calling other parents, and we stop talking about it. We stop checking in with the parent to find out what their health policy is before they go into that kid's house. And so suddenly as parents, we become uncomfortable talking to other parents about what their family health policy is. It's a public safety and a public health problem, and it is preventable and treatable, and there is so much hope out there. But the only way we get there is by working together, because this is a big, big, big deal. When we take a look at the availability of alcohol, parental permission, community norms, the alcohol industry, peer pressure, mental health, family history, athletic teams, easy access, self-medication, big pharmacology, young developing brings, simply wanted to feel good, ACT, SAT, high rate of anxiety, adverse childhood experiences, and boom, it's a perfect storm, and I didn't even have COVID in there. And they're up against so much today. We are all up against so much today. So no wonder that we don't want to use something to maybe tone that down a little bit. And if there's any time we need to work on our physical health, it is definitely now. Steve touched on some of the impacts of COVID. We began to see parents shift to Zoom happy hours and drinking while they're online with other parents. We saw that switch to the work from home life. In the very beginning, Nielsen reports the very first week in March of 2020, we saw a 54% increase of alcohol sales. Online sales increased to 262%. Alcohol use was up 14% overall. Women, especially my age, showed a 41% increase in heavy drinking as compared to 2019. And we began to change those policies and practices around it, as Steve talked about it. You could order it, have it come to your house. It was something that was accessible through Uber Eats, right? And oftentimes people weren't at the door looked to give proof of identification for being 21 years old. And so when we take a look at the high level of stress we all began to feel, the then accessibility to low perceived risk, we really began to see some challenges and some increase. 90% don't get help, and we got to talk about the why. And some of it is perception, right? When I look at this picture, this happens to be my boy out in Montauk, and it's so hard to tell, and we could debate for hours whether this kid is facing the sun or he's facing us. I gave birth to that body. It's hard for me to even tell to this day which way he's facing. And sometimes we forget the perception really plays a huge part in us understanding and works as a barrier for us getting help. So the challenges of being a parent in recovery. I haven't shared with you yet that I'm sober for 31 years. And it became really important to me as my husband was a police officer and I was somebody in recovery. I did not want my kids exposed to alcohol, and I did not ever want to give them permission. And so I did my job and I parented them. And I have to tell you, so many parents shamed me for being that mom, for being the mom who didn't let my kids go to a party where there was alcohol, where there was underage drinking. And if I think about that kind of realistically, wait a second, I was shamed for not letting my kids break the law. But it's so hard to parent a kid today and not knowing what to do. And so oftentimes we put our head in the sand. So we don't have to kind of deal with it or look at it. We sign them up for athletic teams because someone told us if we put our kids in athletic teams, it'll keep them out of trouble. And Steve and myself and others will tell you how many athletes, young athletes we've seen needing help. We've told them not to be like those bad kids, which just shame those bad kids. We told them to pretend that they were drinking when they had nothing in their cup. And lastly, we prayed and hoped that they got home safe. And so when we look at how complex this is, we love our substances. This is certainly a disease of denial, and it's a disease that tells us we don't have a disease. By the time we're looking at getting somebody help, it's generally 6 months past where we needed to first intervene, but we're never sure what's exploratory and what's experimenting and what is something bigger. And so suicide, loneliness, our community norms, the legalizing of marijuana, all of those things come into this complex challenge that we have, including access to substances. And sometimes we get so focused on looking at all this that we don't realize the human toll that this takes. And it's so easy to share from a place of shame on this, in the sense of, I had this opportunity, actually, I think Claudia was with me this day. I had this opportunity to be on Anderson Cooper's town hall, and I was so excited. And my kid was off at college, and my kid who played Division I football was a kid who had been bullied and picked on all his life. And he got to college and he kind of found his place, and he had his football team over because his mom was going to be on Anderson Cooper, right? And he was so super excited about that. And so everybody gathered around. And of course, the football team knew me because I was the football mom who brought them brownies. I know, not shocked at all, right? And so he's like, come on, my mom's going to be on. And so then they're all in there. And here I am on Anderson Cooper. They're like, yo, Jordan, that's cool. Your mom's up there. And here's the one part that I never considered as a parent, nor did my son. Here he was, so proud of me. And the only way that Anderson Cooper's staff identified me that night was not Kim Laube, who looks to make the world a better place, not Kim Laube, who works with thousands of kids all over the country, not Kim Laube, who speaks to 30,000 people a year, not Kim Laube, who loves to be inspirational and motivational. It was Kim Laube addict. That was the only way that I was defined. And for the first time ever, Jordan had this moment where his friends were like, yo, Jordan, I didn't know your mom was an addict. I didn't know she was one of those. And so for the first time in his life, he began to feel shame. And we had the chance to work through that. And oftentimes we don't celebrate people in recovery enough. So we don't talk about the miracle they are, because if you remember, I told you only 10% get sober. So as a parent working through today's world of navigating this space, please, please, please don't ever give permission. Don't make alcohol and using substances easy, right? They may figure out how to do it without you, but don't give permission to it. If you have a party, separate your coolers, because it's so easy to make alcohol look like a Capri Sun. Watch your own behavior. And I ask you, what does your social media look like as a parent? If you're always with your friends partying and the glasses up and the beer up and all of that, we continue to tell them they can have fun without the use of alcohol. And it becomes important that we show them that it's not at the epicenter of everything we do. Have a tough day, easily just wrap up yourself with learning how to use techniques to reduce that tough day. If you're struggling, show them positive coping skills. And I'll end on this note. The same kid, that very same kid who shared with that guilt, and not that guilt, but that shame when somebody was there with me, that same young man who for the first time ever had felt just awful when his peers were so down on his mom and his recovery. By the time I hit my 29th year of recovery, that was actually 2 years ago, he put this all over his social media. Happy 29 years sober to the GOAT. Love you, mama. Now, for those of you who don't know what GOAT stands for, it stands for greatest of all times. Recovery is possible. And prevention and recovery are not at opposite ends of the spectrum. I live in recovery, I teach prevention. But when we make individuals healthier and families healthier, and most importantly, when we make communities healthier, your recovering individual has a better shot. I encourage you, if Syosset has a coalition, get involved. Learn to mentor a kid, because you may be sitting right next to somebody a kid in the community who needs you to step up for them in a way that is so powerful. we do make a difference, not only in the kids in our life, but the kids that are our friends of our own kids. And together, if we can begin to emphasize on that community parenting and helping kids find positive things to be engaged in, and if we can begin to mirror and role model that behavior to them, we all get healthier, and it's a ripple effect that impacts us all. It is up to us. Recovery does happen regularly, and it gets to happen together. And so we are available to work with you in any way that you would need fit. I love working with this team. I have tremendous respect for LICADD. And I'm going to introduce one of my favorite human beings right now. You know those people who come into your life, and whenever you see them, they like just shine from the inside out. And no matter how your day is, they just radiate, and they just have that impact on you where you just feel so warm and loving. Your next speaker, my good friend Claudia, is exactly that person. Now, I may run an organization called Hugs, and I may even give a mean hug, but this woman, boy, she's got hugs down pat. So with that, I'm going to turn it over to my good friend Claudia. Thank you.
Oh my goodness. Wow. I don't know how I'm going to top that. That's for sure. Thank you so much, Kim. And thank you to the Syosset PTA and to Steve Chasman and Josh Lafazan and everybody here for inviting me. I would hug you all, but that's a little difficult to do right now. So, and I am not a clinician. I do not work in this field at all. I'm a mom. I have 4 children. My oldest, Mark, 39, and Claudia, 37, Jonah, 25, and my youngest, James, is 23. And I, wow. I'm thrown by Kim's beautiful sentiments about me. So I really came on here to tell you about my family's journey, and it began really with my son, my oldest son, Mark, when he was in high school, and I noticed that he smelled like pot when he came home, and I believe he was in 8th grade at the time, or just going into 8th grade at the time. And I freaked. Oh my gosh, you know, and I didn't want to ignore it. I wanted to address it right away. So, you know, I sat him down and confronted him. He admitted that he had tried it, and he cried, and I cried, and we talked about it. And, you know, so I thought, you know, good, I'm getting on top of this right away. My son was an athlete. He was a musician, extremely charismatic, great smile, a lot of friends. He played baseball and soccer and football, and he skateboarded, and I believe every year that he was in school, from middle school to his senior year in high school, he got the Presidential Award for physical fitness. His junior and senior year, he worked out with the Marines. He wanted to become a Navy SEAL. But somewhere around 9th grade, he got hurt at I think it was soccer. His knees started to bother him, and brought him to the doctor. And after quite a few tests, they found he had a Osgood-Schlatter disease, if I'm pronouncing that correctly, with his knees. And he was going to have to slow down on his athletics. And, you know, he was in a great deal of pain. They did give him some pain medication, and, you know, trying to find different ways for him to um, have enjoy his time, since he wasn't going to be able to do all the athletics he was doing. He started hanging out with different friends, and oh gosh, it seemed like it happened so fast. The next thing I know, he's, coming home, and I knew he was high. At first, I guess I denied it. I didn't want to believe it. But I have to say, when I would confront him to his face, he would admit to me. He never lied to my face, that I'm aware of. He never missed a curfew. He was always very polite. He did not, fall into the category of what everybody thinks, the stereotypical drug user is. But I knew there was a problem. I got him into counseling. And then he and I both went to counseling. And, this use and abuse, it happens so quickly, and you always feel like you're in crisis constantly. You have to be at the top of your game. I felt like a road band that was about to explode all the time. As a mother, you're always feeling that way anyway, right? Between work and family and grocery shopping, and who has football practice, who has dance lessons, who has a play date, who has homework. You're always stretched to your limit. It very quickly, snowballed. I got him into a day treatment facility, Daytop Village. And I found that they had a family support group there. And that's where my story really began. I went to my first family support group and sat and cried, because who do you talk to about what you're going through? You feel shame on yourself. What did I do wrong? What could I have done better? I failed my kids. I failed my family. And here I'm amongst friends and family, and because they immediately became my family. And I learned about the disease of addiction. I learned about communicating better. I learned about healthy coping skills. It was a really long process. Mark did get a good 8 months of sobriety, and to make a very long story short, he did transition to back to his home school. He was going to daytop treatment during the day and receiving, going to classes there, and and coming home at night, 6 days a week. This was. And I went to family association, or it's a family support group, once a week. We did family group therapy every other week with his treatment. And we did include the whole family. Unfortunately, on May 2nd, 2000, my son died of an accidental overdose. It's 20 years ago, but when I talk about it, it feels like yesterday. You don't easily get over that. It's been a really long 20 years, but I continued going to my family support group because even though I had lost my son, the disease of addiction wreaked havoc on my family. And the disease of addiction doesn't just affect those who are addicted, but it affects the whole family. And we need to recover as a family. We needed to learn to heal and to cope. And quite frankly, after my first year of, really just being in shock, I did not want to have to go through this again, ever. And I didn't want any other family, if I could help them, go through it either. So the last 20 years, actually more than that, probably 30 years, I have gone out of my way to learn about the disease of addiction. I am now a New York State licensed peer recovery advocate, a peer recovery advocate, coach advocate. I belong to 2 support groups. And my biggest advice to all of you is to listen what Steve and Kim, they're just awesome. They're right. The adolescent brain is, it's so important that they have good role models, and not just within the family. I'm not just pointing, but steering them in the right direction and giving balance. But more important than all of that, I feel, is keeping those lines of communication open. For them to be able to come to you, you have to be able to do that without judgment. You have to be able to remain calm and listen to them. The biggest thing that I have learned is something called motivational interviewing. And I have found it not only useful for dealing with my children, but in other relationships and with work. So weird without having an audience to be able to see anybody else's faces. But yeah, I've jotted down a couple of things because I think that especially now, you know, as I said, I'm involved with 2 support groups. I actually facilitate 2 family support groups. And through this pandemic, especially, it's been really, really hard on families and communities. And I've had so many people reach out. And what we started doing was going on walks together, and not together because we couldn't be together, but we could talk to each other while we were doing it, or we could FaceTime while we were doing it. So we could be, there were ways for us to be together. So, and I do this with my, my 3 earthly bound children, as I call them, because now I have one that's an angel. And I became that mother that Kim talked about. My younger kids never went to someone's house if I had not met the parents, if I had not talked to them. They did not go to a party where I didn't, you know, actually go to the door. I think my kids forgive me now, but I was probably not very well liked most of the time while they were adolescents growing up. But there, you know, there are things you have to do as a parent. You know, we did go back and forth on that. They didn't totally hate me, and I think I have a very good relationship with them now. So, some of the things that I thought were super important was educating myself on the disease of addiction and coping mechanisms, and healing, acceptance, compassion, forgiveness, and not just of my children, but forgiving myself. You know, we're human and we make mistakes. Balance in, you know, driving our kids to do well and to you know, do the right thing, but allowing them to be kids too, and advocacy, not just advocating for my children, but advocating for a good community and being involved in my community, taking a stand, going to PTA and going to other community events and showing your face, because if you want change in your community, you need to show up. You need to be a part of that. You know, I see that here. You guys are doing that. I think this is great. I don't know of any other school that's putting this on now. The only other thing that I would say is radical compassion. We need to have radical compassion for our communities, for ourselves, for our children. It's needed now more than ever. So I urge you, I have shared with Melissa a list of resources that you can learn about addiction. I am part of lots of different committees and lots of different groups, angel moms and whatnot, and just who have written books, and there are different movies. There are websites. Mompower.org is fantastic. They have a slew of information on there, and I truly encourage you to look for it and hug your kids. Thank you very much. So I know we had some questions on here.
See, you want to do it?
Sure. Hi, everyone. Thank you again so much for all presenting. That was beautiful. We did have a couple of questions, and if any of you want to go ahead and answer them, that would be great, or give your feedback on it. So one of the questions that came from some parents was, what should parents look out for when their children transition in transition years from elementary to middle school, or even middle to high school? Also regarding peer pressure expectations.
I think one of the things I often share with parents is, let's not make peer pressure sound like they're going to be walking down the street, minding their own business. Somebody's going to take them, hold them down, pry open their mouth and feed alcohol into their system, right? It doesn't operate that way. And it doesn't operate from this place of their friend, these are their friends. And when we say to them, they're not your friends if they make you do that, it becomes very confusing to them. Peer pressure is a simple, well, and even though I can't see you, right, I'm going to, peer pressure is as simple. If I tell you to go like this and put your hand on your chin, I just, for those of you who are on the camera right now, I just want you to take your fist like that and just take it and put it on your chin, right? And you see immediately what you did. And Stephen and Claudia know what I'm always up to. I said chin, but I put my hand on my cheek. My chin is here, right? And so, and I don't mean to, they kind of knew what was coming, right? But I always share that example and other examples like that, because we're always going to follow what we see and forget what it is that we know. Right. And peer pressure is no different. And in those moments when the kids are transitioning from elementary, first of all, it's the most vulnerable time I find for parents. It's a great time to run transition nights. Like people say, parents don't come out for these conversations. Transition nights, they come out because they're afraid of the next big bad building because they heard all the stuff happens there, right? And so putting together well-informed transition nights where parents can learn developmentally what's happening with their kid at the next stage, where they can learn how to coach them through critical thinking and decision-making. But most of all, parents are so afraid of being Karen and having that, like my kids, I used to have that haircut, right? Parents are so afraid of being that parent. We have to normalize parents talking to other parents, especially if we have different multiple schools come into one building, because you may not know the kids from the other elementary parents from the other elementary or the parents from the other. I don't know Syosset's breakdown, but we see this happen a lot. When we can provide more opportunities and normalize parents talking to one another, we can actually help in a very positive way those transitioning years.
Absolutely. One of the biggest reasons I work at my local library, and one of the biggest reasons that I took the job there, was because, especially after my son passed, I was stigmatized and nobody would have a conversation with me. And I still had 3 children in school. So I took that job at the front desk at the library because they weren't going to be able to ignore me. And it has worked. I'm there 18 years now. So, but it's really important to have those conversations. And I'm grateful that, we have all these different formats, PTA, or all the community events. That's where you get that opportunity to meet other parents. And I think it's important you take that.
And not to sound clinical, but just to add to what Kim and Claudia were saying, I mean, listen, there's a couple of areas that someone in our field would look for. If there are significant changes physically, which mirrors adolescence anyway, sleeping more psychologically, remember mind and mood altering drugs impact mind and mood. Academically, if your A or B student goes to a D or an F, there's an old saying, if they're not working on something, something potentially is working on them. By that same token, we have to be really careful not to green light like, hey, yeah, I went through it too. I'm not suggesting anyone on this YouTube, but if you smoke marijuana in the 70s, 80s, and 90s, this ain't it.
Right.
Also, you're green lighting if you have a newly developed basement where kids can safely use alcohol and other drugs. You may be green lighting a serious psychiatric, if not fatal, disorder for someone else's kid, let alone yours. And by the way, in a really precarious time in human development called adolescence, and in a really anxiety-ridden time as we all navigate this COVID crisis.
Yeah. Yeah.
Thank you.
One other thing I want to add, Steve and Kim both talked about it, and that is modeling the behavior. I mean, I talk about that in support groups all the time. We don't realize the impact of modeling behavior, because Kim's absolutely right. They may not listen to what we say, but they are watching what we're doing. And if you're going to have a good, healthy lifestyle and you want your child to do that, then that's what you need to do. I've always admired Kim has, to be a football mom and, have all the football parties, but do that without alcohol and still be the most popular mom. You rock, Kim. You rock.
I don't know how popular it was, but I will share with you, it does take some creativity, right? So some of what we did with our family was, after the football games on Friday night, we opened up our backyard. Fire pit pizza cost me a little bit of extra money. Now, that doesn't mean that every football player that came there didn't drink that night. It just meant that there was an alternative. There was somebody in the community who said, we could do this. Some would stay and hang with us, or we would go to the diner or whatever, and others would go off, but at least they went off on a full belly. So it does take some creativity. It takes investment. It takes a little time. I just want to touch really quick on athletes. One night of drinking negates 2 weeks peak performance training time. So even for those of you who think in your adult life, you're in the gym, you're working out, one night of drinking negates 2 weeks peak performance training time. Now, there's a whole lot of other science, and I always encourage people to look at John Underwood's work, Life of an Athlete, but we know alcohol and drugs play a major impact when it comes to our athletes. And so for our prime athletes, we find almost always they choose to not drink and not put substances in their body so they can be at peak performance. It's always so important to understand that this isn't necessarily about don't drink because you can have an addiction. This is all about how do we keep our bodies at optimal health. And so it doesn't necessarily have to just be about preventing addiction. This is just an overall good choice to be in and to make, and to be applauded. Actually, we don't do a great job at applauding the kids who are by choice choosing to work on SAD chapters and work on prevention programs in school. We really don't do well at honoring them and giving them credit when it's due for trying to keep their school community healthy.
Right. Yeah.
Thank you, Kim. That was really a great point. And you guys did a wonderful job at answering a lot of the questions in your presentation, but we just have one more before you close. Another question that came through, and I know, Steve, you kind of touched on it a little bit, was how do you explain to children the newly passed legalization of certain drugs in some states? So like, how do you tell your kids, why is this allowed?
Well, it's a great question. I mean, listen, I'm a mental health professional, so I have the luxury of, when I speak to adolescents or adults, I only speak to, again, what is healthy and unhealthy. I mean, alcohol is the legal one, and it's the most lethal drug in America for the last 100 years. So we don't get stuck on legal or illicit. I mean, these offices are traditionally filled with people using cocaine and heroin. Could you imagine if I said heroin, that's illegal? They would run out of this office. So, we're only here to address what's healthy and unhealthy. We have partners with law enforcement, but it's been my experience with adolescents. or adolescently arrested adults, of which I qualify, you get a lot more honey, you get a lot more progress with honey than vinegar, meaning like, just explain to them what it is and why you're making the recommendation of why it's unhealthy. Listen, on a private note, and there's nothing private about YouTube, I understand budgetary shortfalls during a statewide shutdown for 4 months, but I think it's extremely short-sighted for New York State to be getting into the legal drug dealing business at the risk of the health and wellness of our citizens in New York, because they need $200 million in revenue. Kim and Claudia, we remember when the legalization of gambling came down, and this affects school districts, because we're going to fix all the problems in the New York school, the New York school districts from Rochester down to Montauk, and all the revenue that was coming from legalized gambling, including Jake's 58, which, by the way, just reopened and is 24 hours a day. We haven't seen $1 for another debilitating illness called gambling or anything else. And listen, Kim, myself, Claudia, we've been advocating against the legalization of marijuana. Medical marijuana, indisputable. There's 11 illnesses. No one's doubting that. But, this is short-sighted in the interest of public health. And Kim talked about that at the height of an anxiety-ridden time, to be giving a breeding ground. And listen, we're first seeing data out of Colorado and Nevada and California. The car insurance rates for people under 25 are astronomical, because people are on their devices driving and they're stoned, let alone all the fatal and non-fatal accidents. And if nothing else, listen, people ask me all the time, how many people you know overdosed on marijuana? 0. But ask me how many people I know you started using marijuana in their adolescence, that somehow their dreams, academic, vocational, just didn't materialize. I got a good friend who's really bright, but he's 50 and lives in his mother's basement. He plays a really good game of PlayStation, though. No judgment, but sometimes we deprive ourselves the opportunity of really growing up. And as every one of my colleagues talked about tonight, it's what we need and what we want often is juxtaposed. We want comfort, we don't want to work too hard, and we want to progress. These things only materialize if we work for them. So that's all I got to say about that.
I think it's really important to note that just because it's legal doesn't mean that it's okay, it's good for you.
That's right.
It was legalized to make it easier on the prison system. And really, all the people that were being arrested, in my humble opinion.
Just to Claudia's point, just because something's legal doesn't make it healthy for you. And it's definitely not healthy for you if you're under 25.
Yeah.
And my last thought would be, legal or not legal, we need to talk early and we need to talk often.
Yes.
And we can't leave the talk about drugs and alcohol to the night before prom or just the night before they go into high school. That this is a policy, a family health policy. And New York State OASIS has some great guidance for parents of what to say between 0 to 4, what to say between 5 to 8-year-olds, from 8 to 11. And I can make sure that your leadership gets those documents along with other resources that could be readily available. It's not just a one conversation. It's not just one assembly. It is about the ongoing practice of this conversation, the same as we remind them to put sunscreen on often when they're at the beach. We have to add this layer of protection when it comes to substance use disorder.
Absolutely.
And I think
having you staying away from the hard conversations. I think if the epidemic, this quarantine taught me nothing else, it is that you have to have the hard conversations in everything.
And I think I'm speaking for the panel here, and hopefully they'll afford me the latitude. These three, well, myself, but Claudia and Kim, we fully understand. Drug users are not bad people at all. Traditionally, everyone is good. They just make some unhealthy choices, but those choices start early and they could progress for some into really, really unhealthy consequences. So if you hear a sense of urgency, and I always commend Claudia, F, for putting her grief forward. She belongs to a club no mother or father or sister or brother wants to belong to. And Claudia's from DC to Albany and beyond. Kim and I, come with some experiential, teachings, but we're just trying to prevent what is ultimately preventable for some. But if we don't have these dialogues, as Kim said, regularly and with vigor, there's a downside. If we spoke 7 months ago, we would tell you we're in the midst of a healthcare epidemic, and it was before we heard the phrase COVID. It was the opiate crisis that was killing a whole generation. And by the way, Nassau and Suffolk had among the worst incidents of overdose in the entire state. So we were the epicenter of the crisis. And again, a heightened state of anxiety and fear doesn't help, but exacerbates all those symptoms for experimental substance use.
Okay.
Well, that was like NPR right there almost.
Well, Steve, Kim, and Claudia, thank you so much for this evening. There was so much information. It was heartfelt. I, can't thank you enough. This, drugs and alcohol hits me hard to, it's, from my, to my home. And I think it probably hits a lot of people out there. More than we all want to know about it. But this conversation, you're right, has to continue. And that's why it was so important to all of us, part of this committee, to make sure that we brought this, especially right now, because there are so many people due to the pandemic that are suffering mentally. A lot of the children that are, having a hard time, dealing with the way the world is right now. So I think that having you all here this evening is going to be a tremendous help to a lot of the parents in our community. And I think each one of you had just a wonderful thing and an impact tonight. So thank you so much for sharing and being a part of this evening. I know you're going to be a huge help, and we hope that you can come back.
Remember, the three greatest words in a time of crisis are, I need help, and to be able to ask for it. From school-based professionals, parents too, to ask for help with parenting, patience and tolerance, or to call a hugs, or to call. Claudia's phone is always open. I know many people, including me, who have called it for support. And LICADD's available 24 hours a day in Nassau and Suffolk. And all of our services are virtual, and we're very rich in services, but you gotta utter those three words that are so powerful and so empowering. I need help.
Absolutely. And we're going to make sure that we post all of it on the Syosset Council of PTA's website, and this presentation will be shared. So thank you all for coming this evening. We appreciate it.
Thank you.